I was inspired to become an ENT specialist because it's a specialty that encompasses many different areas. Operating on the ear is different than operating on the nose, which is different than operating on the throat.
I first became interested in the field of ENT when I was in medical school. That's when I began to learn more and more about the type of an impact that an ENT specialist can have on a patient.
So I've always enjoyed building things and working with my hands, so I knew pretty early on in my medical training that I wanted to be a surgeon. And then that first year of medical school, when we're kind of learning about the different parts of the body, I really enjoyed head and neck anatomy and anatomy involving the ear, nose, and throat. And so I thought this would, ENT would be a good fit.
What inspired me to become an ear, nose, and throat provider was that initially when I was at PA school, I followed another PA who did otolaryngology. And then I went on to do a rotation with a MD who did ear, nose, and throats. And I really fell in love with it at that point. I really like how hands-on it is.
What inspired me to become an ENT provider was a Craigslist ad back in 2008. It was my first job opening to get into Austin. Took it, fell in love with ear, nose, and throat, mostly ears, and could never get away from it.
Capital ENT and Sinus Center is special because we have the ability to not only obtain all the tests necessary for diagnosis, but then we can treat all of those issues as well. The other thing is that we're a big team approach office. We like to use the team approach with our staff as well as with our patients to make sure you're getting the best treatment possible.
There's lots of different things that make Capital ENT and Sinus Center a unique practice. Number one, it's a very comprehensive facility. We treat all sorts of ENT problems and have a lot of diagnostic abilities on hand, on site. We were able to do that with sort of a family-centered, patient-centered approach. So I feel like most patients, when they come through our office, they really get a sense of belonging. When I was looking around at various practices around the country, that family-centered approach, patient-centered approach really stood out and made this place unique.
So I joined Capital ENT at the end of 2019. It was really one of the best decisions I've made. We just have a great team of doctors and physicians assistants and nurses and medical assistants and front desk staff. And it really just makes it a joy to come to work every day to be able to take care of patients. It's just a great group.
What sets us different from other ENT providers in town, we really emphasize education for the patients. We want them walking out of here and knowing what's going on.
I really see that Capital ENT provides just an excellent experience for patients. We really aim to treat patients rather than disease here, and I think that's so important. We kind of want to know what your story is coming in, rather than just jumping into what's kind of wrong with you.
Visit the experts at Capital ENT and Sinus Center to breathe better now.